Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Welcome back, everyone, to the Functionally Enlightened podcast. Today, we have a very special guest returning. She is Randee Engelhard, a founder of Realign by Randee. She's a licensed physical therapist and certified posture alignment specialist, but her journey has expanded far beyond traditional physical therapy. So, Randee, I know your background started in exercise science and physical therapy, but your path led you into alternative and functional medicine and ultimately NAET therapy. Can you take us back to where it all started and tell us a little bit about what sparked your passion for understanding the human body?
Okay. First of all, so nice to be here with you. Super excited to share about all these techniques. Okay, so I started in college. I was very much into exercise, and that led me on my first degree of exercise science. I loved learning about the body, and I ended up really loving science. And then I took a long journey to get to the physical therapy. So in the process, I actually took extra science courses. So more biology and genetics and things like that were along my path on the way to getting my master's in physical therapy. And then I worked as a physical therapy. It's now been 30 years since I became a physical therapist, or close to that. And I was working in different offices in different settings, and I saw a lot of great things with physical therapy. But depending on what position you were in, sometimes you were dealing much more with chronic pain, which I did find that the physical therapy did not help as much. I saw a lot of patients returning with pain, finishing their sessions, and after a period of time not being resolved or not being resolved enough. I saw, different things with car accidents or workers' comp and different ways that, and disabilities for different reasons. So I kind of was open to other things. And the path to finding the posture therapy was that I had hip pain and my husband was having chronic back pain. Physical therapy was helping some, but there was something missing. So I found this technique called the Egoscue method, and I got certified as a postural alignment specialist by the Egoscue Institute. And that was great for me. Like, as I found it and practiced it on myself, it worked. And then it took my husband time to really embrace it. But when he did, it was life-changing. And for him, he practices it very regularly to help manage and it's just been very life-changing, where he was an athlete that sometimes would take out a walker because his pain would hurt so bad. So, and that, he's not using walker or anything like that. He's active, he coaches, he works out, all kinds of things like that. That was how I got to the posture therapy. So I then went on a journey for many years of really honing those skills. And I started working in more functional environments, people looking at the body as a whole. But at the same time, I also had a lot of physical ailments that were going on. I had reflux and some allergies. I had never slept well my entire life. I had certain GI stuff since I was young. So I was working with alternative practitioners at a certain point because Western medicine wasn't working for me. Mm-hmm. So I was doing that. And as I would study everything, and as I would have the care, I would then study what was happening and why was it working. And if somebody said you need to remove this food, it's like, why? And so I was learning a lot of things along the way. And so I then worked in an office where there were NAET practitioners. So I'd already now had NAET as a patient. It did so many amazing things for me. So this is as years are going by. I'm posture therapist, physical therapist. But then I start working in an office with the NAET practitioners, and eventually I got certified, and I was able to be well trained by the two practitioners I work with that had exceptional experience. And I really kind of did a mentoring where I worked with them for like a year training before I went into practicing it. And then they have since, more recently in the last 5 months, they ended up retiring and stopping working. So I am continuing on in a different office space with other acupuncturists, other, holistic alternative practitioners. But I am continuing still some posture and physical therapy, but predominantly the NAET, as there's not a lot of practitioners for that. So, and people really get great results, and people travel an hour away, people fly in because they trust the technique and the way it's been done for years in the office. So
Right.
that's how I got to where I'm at today.
Right, right. So it's such a relatable journey too, because so many people come into that functional medicine space because they haven't really gotten answers that they needed elsewhere. And so I know that your passion is there with your own personal experience and how you've seen your clients improve in multifaceted ways. So you mentioned NAET, and some of our audience may know a little bit about it, but can you explain to those who've never heard of it? It is an acronym, so can you let us know what it is and how you use it with your clients now?
Okay, so NAET is Namudropod Allergy Elimination Technique.
A
And
mouthful.
Namudropod is the doctor who founded it in 1983. And it is a way to reduce or eliminate allergies, sensitivities, intolerances, and body imbalances without the use of drugs or needles. So it's very comfortable. It's non-invasive. It actually can be done with infants and pregnant women and adults of all ages. So that's the what is NAET. Yeah. But then we can go into how do I test and how do I treat?
Yeah, let's talk about that a little bit because
Okay.
again, people are thinking, we go to a physical therapy, it is a physical location, we're having manual work done, but this goes beyond that. So let's hear a little bit more.
Right, right. So yeah, when I'm doing this, there are all different practitioners that get certified to do NAET. So this is really a technique that is a blend of chiropractic, acupuncture, because it is acupressure, nutrition, it's quantum physics. Like it is a blend of multiple techniques. So that's why you'll see different practitioners practicing it. Part of it is the testing is through kinesiology, which is muscle testing, which physical therapists do get very trained in muscle testing, but it sort of in a different way. You're testing if somebody's strong or weak, and you're testing all of the muscles. This is you're testing if you're reactive to something. And if you're holding, I have like a little kit here with the vials. So this is what the little allergen vials, this one says vitamin C. And so somebody's holding them, we'll see if you're strong or weak. And one of the reasons how that works in the body is if somebody was on the phone and they were at a hot stove and you accidentally touched the hot stove, you'd move your hand before you even thought about what was happening. There is a reflexive nature when you're holding something that your body is not having a good balance with your energy frequency, and that item's energy frequency are not meshing well. Will get a reflexive weakness. So that's part of the testing process. So testing is kinesiology, treating is acupressure and acupuncture points. Now, a licensed acupuncturist could use needles as a part of it if they wanted to, but I use all pressure technique, as that's what I'm trained in. And it's a very simple, like, massage on your back with a machine. I didn't mean to, sorry, with the machine. Because we're in my office, we can see that this is the machine, and it's very comfortable. It goes on the back. And so there's different types. So there's a little bit of other key acupressure points with some vibration. So there's a treating, and then there's a resting, and then there's an avoidance for whatever you're treating, which is how your body has the chance to reprogram or reset to that item. And so people with who have had lots of chronic illnesses and things like that might have multiple things that they need to work on, depending on how far down line. You have somebody who's very minor that has one little symptom that they could address very simply, or you could have somebody that has a complexity. Like I had many symptoms. I was functioning somewhat, but there was a lot of symptoms that I had. It's different skin things, the reflux, the sleeping, anxiety, so many things. So I had a lot of things to work on. So it really depends on the person and how much they need.
Yeah. Now let me rewind just a second. I know 5 years ago I did approach Nate, and I remember that there was like a base protocol for me to do. I can't
Yes.
recall what exactly it was. I know I had some of the typical allergens that people experience, like eggs, maybe. I don't know if gluten was there, but you mentioned some of the vitamins. Can you tell us a little bit? Does that still apply? Do we do
Yes,
baseline?
absolutely.
Okay.
That is one of the biggest things with NAET is the basic 15, the basic protocol. Sometimes you might read basic 17, but that was like kind of an adaptation as years went on. But most stuff online you'll read will say basic 15, and you test those when you start, and you treat those as needed in pretty much in order.
Mm-hmm.
That is, there's a body balancing formula that has to do with your autonomic nervous system. There's an egg mix, which is your egg and chicken, feathers, things like that. Vitamin C, B vitamins, sugar, iron, vitamin A, minerals, calcium, yeast, grains, which includes your gluten and wheat. You have two parts to the whole digestive system. They call it acid and base, but it's pretty much all of your gastric secretions. And there's hormones, and that's pretty much, I think, all the 15. And that picks up on, depending on somebody's symptoms, their picture of how many things they're going to be having a problem with ties a lot to the particular symptoms. Like if you're really environmental, you might have vitamin B or C, and they're in the plants and the trees, or even the minerals. Kids that have maybe focusing issues, it could be the B vitamins, which are sleep, focus, and mood, and minerals that it could be they're not processing and detoxing them well. So it's basically your body's energy and whatever the item is are not working well together. And this helps to rebalance and reset.
And it's pretty
Yeah.
pain-free, so people don't have to come in with that reservation, like, oh, another protocol that's going to cause a Herx reaction.
For sure. Harder part of the avoidances, but you get through them, and it does get easier with time with what you're doing. But yes, I would say no pain, absolutely, like no pain, which is like that's nice, especially for little kids too. And you can treat. I did have there is actually a testimonial on the prior office I was in, Points to Wellness, and someone who did have mesh put in her body, and she was able to get mesh. She was having a like a hive type reaction, and she was able to treat. And at this point, as far as I know, she did not have significant reaction, and she did not take it out at this point. But that's just a minor, you know what I mean? You can treat a diversity of things, but I do think when it depends on the complexity of the body that's coming to the table with getting that, what's happening. Like I said, I had so many things, so many symptoms that were feeding into each other.
Right.
So it really depends on your whole immune system and how your body's functioning.
Yes. And Randy, I love that you brought that up because especially with that case with mesh, a lot of people are looking for a way to test for reactions. And there is something called the Melissa test where you can submit the sample and they can test it against the person's DNA, but it's very unaffordable at this point. And I think the laboratory is either in Greece or Switzerland or something. So even at that sense, like for the United States, very few places to find to actually do this testing. And then furthermore, when you go to an allergist, they do the skin patch testing and you don't necessarily react to the material. You might react to the adhesives. So it's not really an accurate way to test. And then the only way that we've seen that can reflect an infection, obviously, is to remove the implant or biopsy an area. And you send it to a lab, and when you see the pathology, you can figure out if there's a bacterial infection. More
Mm.
more times than not, you'll see that there's some granulomas because of the chronic inflammation that's happening in the surgical site.
Yeah,
But when it's a foreign body like this, you're not able to excrete it like you do through like food, right? You can excrete it.
absolutely not.
So
Yeah,
so
cannot agree.
your body is constantly inflamed. And I'm thinking of your client there where you may have been able to treat that reaction and she wasn't able to have an explant or decided against having an explant because now the symptoms are well managed. Did she ever return with anything else that might have triggered some type of reactions?
I have not see she has 3 children, so very busy mom. So I
Of
don't
course.
know because
Uh-huh.
she's busy, running whatever. And you don't know what somebody's journey is. I just know that in that instance, it was a tool and it helped in that. And that's what I'm saying. Maybe it's maybe part of somebody's journey,
Mm-hmm.
you know,
Yeah.
again, to be able to function until, depending on how something's affecting your body.
Mm-hmm. And I'm a very big advocate for that approach because we are exposed to toxins on a daily basis. I talk about this often with the air we're breathing, the water we're drinking, especially, if you're drinking tap water, municipal water, we know they treat it, they kill it off with chlorine, they kill off all the bacteria, but we're consuming that. And I'm not to get into the biochemistry, but I'm thinking of all of these ions, the chloride ions, and replacing or displacing our minerals like magnesium. And you mentioned you do test minerals as part of the base or what was it, the
15. Oh
15?
yeah.
Yes, yes. Well, what are the minerals that you're testing and if someone reacts, what is the treatment for that?
Okay. When you're testing, you're not testing minerals I mean, you can if somebody comes in with a specific issue. A lot of
Specific.
times somebody comes in about sleep, you're good, or muscle cramps, you might look at magnesium, that's like an
Mm-hmm.
obvious one, or you're going to look at fluoride because that sort of fits in though that family. But the minerals vial is minerals, literally, like it says mineral mix,
Okay.
but it is the frequency of many minerals together.
Okay.
So in the basic 15, you're just testing minerals as a group. But if somebody is having a problem with enough of those minerals, they're going to be very weak. And most likely they'll notice something different after they treat it. Now, it's the same treatment no matter what vial you're treating. You're holding the vial, you're getting the treatment of the acupressure, you're resting, you're waiting, and then you're removing the allergen because it's in glass. What's in the vial, it's transferring the energy through the glass, and that's how your body is touching it without having anything go in your body.
Mm-hmm.
And it's an energy signature
Yes.
of the item. And then it's that avoiding. We have a little explanation for what to do for 25 hours, how to minimize the amount of minerals you come in contact with in order to pass that treatment. And then somebody who has a particular issue with that, we might look deeper in terms of minerals. And then you can look at copper, manganese, iodine, all different things based on what's happening. That's when you get very personalized. But there's many, I would say a good 40 to 50% of the time, people have a minerals. It's pretty common as being a positive reaction to the body. And it does have, fluoride may not be a natural mineral, but I believe that is part of that because of the chemistry.
Mm-hmm.
So, that's an item that a lot of bodies have a hard time with.
Yeah. Yeah, that
you know.
makes sense. Yeah, it's pretty fascinating to think about the energy and the frequency medicine that can be involved. And I'm pretty new to this. Maybe some of my listeners are probably more well-versed than I am. But not too long ago, I guess late last year, I did go in for some muscle testing similar to that in order to rule out things like Lyme disease. And I went through a series, oh my gosh, it was a long appointment, maybe 2 or 3 hours of going through all of this
um,
testing. And, I did fairly well. I've been working on detoxing for 4 or 5 years now consecutively, like no breaks, and I'm not cheating on my diet or anything. So I've been working really hard, but we still found that I was reactive to the Lyme vial, and there was another vial. I can't recall what the other one was. But then we developed a protocol. They did not do the NAET, which, would have been an amazing thing to incorporate. So I did this full-on supplemental protocol, and yeah, that was
right.
that. And obviously, because I'm data-driven, I tested the blood too. I tested using the Vibrant Wellness Panel, and it was confirmed with Lyme. So I
Mhm.
became a believer
Love
then.
that.
Yeah,
Yeah.
yeah. So I want the audience to know that this is an option, a viable option, and if they want just like the data the same way that I did, that you can always come back in and do some serum testing or functional testing that might be able to validate. But I would never say wait for that result because so many things in our body are what we call hidden stressors. We can't necessarily see them, but we feel the effects of them. So just kind of switching gears for a few moments. I know that you've helped clients with fibromyalgia, the chronic back pain like your husband, even skin conditions, the GI distress, and even like the anxiety and depression that comes about with just day-to-day living or having to deal with these chronic ailments. Have you noticed any patterns or like root causes among those type of cases?
Okay. I'm gonna answer something in response to what you said about the testing, and then I'm gonna talk about the root causes. I think this is a really cool piece that you mentioned about the Lyme and then having the data with the testing. You can get blood work if you get IgE allergy panel from a primary or a skin test. The muscle testing is very parallel to that. If somebody has an IgE reaction, you see it, so much of it, it's weak when we muscle test. Now, there are people that will have like no blood work says I am fine, and they are like uncomfortable. That's because there is IgE, IgA, IgG, IgM, even IgD. These are all antibodies. So not every reaction in the body is on the IgE, which is done in our Western medicine practice. That's how that's tested. So you could have a food sensitivity test or even a chemical sensitivity that looks at the IgA or IgG, and you're going to have the same thing where most likely NAET will just pick up that there's a reaction. And there is a lot of parallel to the testing. And we do have people bring in tests all the time, and that helps direct the treatment. But like, you can not show the test and we're muscle testing and you get, the results are so similar, if not the same in many cases, that you can, hit all the ones that are positive. So that is another nice data piece to this. Okay, so going back to the root cause of a lot of these chronic inflammatory, because we're talking about fibromyalgia, there's an inflammation system going in the body, the chronic pain, even eczema. It's an overreaction of the immune system or an overreaction of the inflammation response in the body. I do think that, some kids are genetic, there might be a genetic, like if you listen to somebody and they come in with a lot of environmental allergies, there might be somebody in the family who has that pattern. But then I believe from what I see, there's a lot of the toxins in our world that are affecting our gut. And then with the root of the gut being affected, then particles are getting out of the gut into the body, and then the immune system attacks them, thinking that they're foreign when they're healthy, good substances. And we do, over the years, patients have had stool tests from different practitioners that are ordered, or the practitioners I was working with, like, there's always other functional medicine. I am just doing the NAET. I am not ordering the stool test, but many patients will end up having that. And you can see a parallel. If somebody's feeling terrible, you see things within the gut, and lots of reasons, whether it's too many parasites or the zonulin's too high, but like, or staph, candida, all of those things. And the patterns are not this, the same from one, if you take a fibromyalgia to an eczema, to something else, but there are definitely patterns within the eczema, and there's patterns within, the acne or the chronic pain and stuff like that.
Okay. Yeah, I guess there is no generalizing because it is truly bio-individual. Each client will come to you with, they can have similar presentation and symptoms, or maybe not, but we can't really categorize them into like, traditional practices. This is related to this diagnosis, but we receive so many different diagnoses. They might share the same symptoms, like for instance, fibromyalgia and dysautonomia, mast cell activation. They might have similar symptoms, but you ultimately will still treat them similarly, like trying to find what are the triggers
Right, healing the gut.
Mhm.
Right.
And you work on healing that. But with NAET, there's more of like an immune modulatory response. Is that right?
Yes, exactly. You're trying to get the body to, let's say if you're reacting to vitamin C, that is so important for your immune system. So it's like we treat it. It doesn't mean if you're weak to it, it does not mean you're deficient. It means your body is having a problem with the vitamin C or the foods that have vitamin C in them.
Mm.
So when you treat it and your body is now accepting it as a safe item, now your body can utilize the vitamin C better. You can have immune system better. Some things are easier to see. Common with eggs, there's eggs and eczema. There's a big parallel to people with allergies with eggs.
Mm.
That happens to be the first one. So if you happen to be somebody in first, like right after the body balancing formula is the egg mix. And if people come in with eczema very quickly, if they can handle going in order as normal protocol, like let's say somebody who's anaphylactic to eggs, you're going to take a different approach. You have to be mindful of severe allergies.
For sure. Mhm.
But barring that they're eating eggs, they don't even know that they're really the part of the culprit. You can treat eggs and very quickly the eczema will change, and they will have changed nothing else. But, or in that process, we that week we take away eggs, and the parent waits to come back to check. A lot of times it's kids. We see a lot of kids. It's adults with eczema too, but a lot of the kids. And and even just whether they take it out, but once you've treated it and it's safe to go back, they can eat it and not have the eczema. Now, all cases are different. So some people, it's multiple things that are bothering them, not just the eggs, but that is one of the biggest culprits. So it might lessen it, but then they have to treat other things to make it so that it goes away.
I can see that. And have you had anyone experience like the Herxheimer reaction after doing a treatment? For instance, if someone onboards a supplement or even a pharmaceutical and then they develop additional symptoms. Like in my case, I had hyperhidrosis happen where I've never had that in my entire life because I struggle with like the cold hands and cold feet. But after I brought on a pharmaceutical, that was a brand new symptom, like always sweating hands, sweating feet. So that's just one example. And then with physical, they have like ozone therapy that some people get a chronic pain response I've seen, and it's really strange. So wondering if you've seen that with NAET.
Okay, not typical to have like a totally new symptom that I really haven't seen that. Sometimes you will like have a flare of eczema or a flare of a sneezing allergy. But reasons when somebody will call the office and say, "Oh, I'm a little worse," or whatever. My first question is I need to check and see if they've passed the treatment. So if your body has a hard time clearing something with things that people have a bigger allergic reaction to more antibodies to that item, they might need more than one treatment. And sometimes if they don't clear it all the way, then their symptoms might be a little aggravated in the process. They could also not pass it because they didn't do the avoidance properly.
Right.
So rechecking the item, but those symptoms will like slowly die out anyways, because you didn't put anything in the body. It's just how the body may respond.
Mhm.
But the other thing that is very interesting is that when you're treating for NAET, at some point, if you have a lot of reactions, you're avoiding one thing for the 25 hours, but you're eating something else that you don't normally eat, possibly more than normal for 25 hours. So sometimes it's, what did you eat in those 25 hours? If you don't feel fantastic, it's like your body didn't love what it had to eat because you couldn't have certain food, because again, some of the kids are picky, some adults are might be vegan or they have they're already their ways of eating. And so then you're telling them for 25 hours, follow this avoidance. So you'll see some of those complaints, but I would say NEAT is very well, on the whole, it's a very well tolerated. And if somebody's feeling a little tired and fatigued, or maybe a headache or something, some of those reactions, as they get a few treatments done, get better and better, like as their body is getting more balanced. And that's part of, the Chinese medicine aspect of it, is like bringing the body more into homeostasis. So the closer your body is to being more balanced, it feels better overall.
Yeah, and in my view of it, and again, very novice, but I'm seeing this practice as a mechanism to open up drainage pathways. So, like, especially lymphatic for people who have gone through multiple surgeries or have experienced chronic traumas, whether they be emotional or physical, everything is stagnating. So I feel like with this treatment, you're identifying things that might be blocking them and then able to allow the body to naturally do its thing once you treat it.
Yes, especially right. If there's an organ, something, a cell, an organ that there's a complexity of NAET can get into, that something can't function well, the hormones can't function well, something that you treat that your body starts to naturally work on its own.
Mhm.
And something that you had said before also about the supplements, is that when people take the different protocols, which many of our patients work with other practitioners on detoxing protocols and supportive supplements, which are very valuable. But NAET we can muscle test for them. They can bring the products and we can make sure that their body is not reacting, and treat it if they need that supplement in order to treat an organism in their body that their body's having a hard time with.
Love
But
that.
if charcoal is part of the, or it happened recently, somebody was trying to take pyloriplex because they had H. pylori, but they were reacting to it. So you can treat the supplement so it can, if needed,
Yeah.
on priorities of all the things.
Yeah.
And also anesthesia.
Mhm.
Um, Especially if you've had a problem with a surgical issue, there's definitely a lot of aftermath from anesthesia, and just treating the anesthesia, if your body was having a reaction to it, will help that reaction pass through a little quicker, faster, because a lot of times you do need to detox those chemicals out of your body, and it can help the symptoms move along faster.
Yeah, I love this as an option for people, again, with mast cell activation disorders or just that heightened, we'll say, cortisol response or the
Mhm.
sympathetic mode, because they might be developing a fear of trying new treatments because they know the body is reactive to it. So I like this as a calming way to approach things. So with that, kind of shifting into the mindfulness piece. I know you talk a lot about the power of positive thinking in the healing process. Like that is a requirement. Can you share why that would be important for a client coming to see you with any chronic condition and, maybe some that are more disabling conditions that they've experienced?
I'm First, I would want to say that thoughts are super powerful. I really have done a lot of studying and reading, like the Joe Dispenza. There's many practitioner books, speakers of all different techniques. Dr. Nelson, who did the emotion code, a lot of different practitioners talk about how powerful our thoughts are on the body, but then also how we can trap emotions in our body. So an easy or an example might be the child that has an anaphylactic reaction or something may become fearful of the peanuts, or a person who was eating an ice cream and there was a car accident while like right nearby as you're outside eating your ice cream, there might become a negative reaction to dairy, but part of it is an emotional response. I mean, we still would treat the dairy, but so somebody who has a disabling condition has experienced many negative or just all different kinds of emotions along the way of that process, with expectations of something going well and then it not. So innate, I mean, as first of all, yes, I believe positive thinking is helpful to the healing process, but innate, we also can treat emotions and release emotions. Now, we don't introduce this all the time because people have to be receptive and open to that. And there's a lot of great that NAET can do without going to that side of things, but it is an aspect that can be done. There's similar techniques that aren't part of NAET that I've learned over the years that have to do with releasing emotions. But it is powerful also. Kids are always a good example because kids are, don't even know, like they're just along for the ride. And there's times where you can treat an emotion on a child with the help of the parent as a surrogate. And teachers will be like, what is happening? The child's handling, or they start sleeping better. They had, fears. So the thoughts and emotions are extremely powerful. But I do think if there's one piece that somebody could open up that's dealing with a disabling condition, is to really open their minds to how much power they have over their own body, to at least maximize their position, their condition, and kind of reach beyond like the goals of what a doctor may say you're going to be able to recover or do.
That is super powerful. I know that you offer appointments. Is it in person only or virtual? Are you able to do this remotely?
Okay, so NAET is an in-person technique. However, people do travel. I'm in South Florida, and there are people that come to the area and they'll do a set of treatments for a week or 2 weeks or something, depending on even, a 4-day trip, and they come periodically for treatments. But in general, it is in South Florida. Now, I could speak to somebody online. I will speak to people for sure. I will do phone consultations to help somebody decide, do they want to travel in. The posture therapy that I've been doing for a long time, the posture therapy can be done actually on Zoom. So that is a piece that I can do from anywhere. But I am accessible to help somebody, answer questions. And sometimes, there might be a NAET practitioner in their area. And I do think there's some of the basic things they need to be following to make sure that the NAET will be successful.
That's perfect. I know, and I didn't mention this at the start of our show, but for our listeners, I did see Randee many, many years ago at the beginning of my chronic illness journey, right after surgery. It was just a
Yeah.
few months. I think I'm not sure if I saw you before or after explant, but with that whole posture alignment piece, you are the first, you and there's a Dr. Simpson who both of you were the ones who kind of spurred me into continuing to look for more functional and more things that were aligned with the whole being. So I do
Yes.
recommend seeing someone like Randee, especially if you've had multiple surgeries or one surgery, or you've been, kind of, I will say mobility has been hindered and you haven't had minimal physical activity, then this is an approach that is gentle and can really set you on the right path. And there's so many things I can say. The whole posture alignment affects neurological thinking and your brain cognition. So we won't get into that too much, but I know that in our you were one of our very first guests. So for those of you who want to hear more about that, definitely visit that episode. I can link it in the show notes. But for people who now want to learn a little bit more, or maybe they want to book a session to one-on-one work with you in terms of that posture alignment and to just learn more about NAET and get some guidance, some general guidance, how can they reach you?
They can reach me on Realign by Randee, and that's RealignByRandee. So Randee with two E's. And that is my website name. That's my Instagram handle.
Perfect.
There is a Realign by Randee Gmail. So basically there's a contact page on the website. There's a booking page. So there's multiple ways to reach me. And a phone number 954-873-5666. So that's the other way. And one thing I just want to say is, yeah, it's amazing to watch you from like where you came from. And you had already had the explant when you came. And I do feel like together, like I love to think out of the box and I love to problem solve. And I feel like each session that we had, it was like you took what I had to give, but then we were problem solving and trying to figure out all the pieces going on. And it's just amazing to see where you've gotten to and how it's changed your life in a way of such growth.
Yeah, and Randee, that's why you're such an amazing practitioner because you listen to your clients. That's first and foremost what they need, especially having gone through so much with the medical trauma. So we appreciate practitioners like you.
Yeah, thank you. And yeah, I think that is important is people have there's a lot that you on the inside know, like the patient, that's very much part of like the posture training was very much the patient is the expert in their body, like they're inside it. And so listening to them, a lot of times they have the answer. And with NAET, how we figure things out is we are listening to a lot of their details and asking a lot of questions. And then there's the muscle testing, but there's so much in the patient and what you instinctually know about your body.
Yeah, yeah. So Randee, again, thank you so much for joining us. It was such a wonderful conversation. I learned so much. And to our listeners, if you found this episode helpful, make sure you drop your questions in the comments and you can subscribe so you don't miss our next episode.
It was great to be here. Thank you.